Rebecca, you can go ahead today.
Good morning, everyone. Thank you so much for joining us today. I'm Rebecca Pratt, the Co-Associate Director for Community Outreach and Engagement, and it is my absolute delight to be introducing this topic and speaker today. Today, Dr. Maiyia Kasouaher will be joining us to talk about the Community-Centered Dissemination Toolkit. I know that this is work that has been a labour of love for Maiyia and colleagues over a period of time. And we are thrilled about how important this is for the topic of community engagement and outreach. Maiyia comes to us as the lead community engagement specialist at the Program of Health Disparities Research, and is also a community-based researcher for Solano, a community partnership based at the Community University Healthcare Clinic as well. So with that, it's my pleasure. Thank you, Maiyia, for joining us, and we'll look forward to your presentation today. This is a fabulous topic and a great opportunity to ask our expert here questions. So please keep your questions coming throughout or at the end, or pop it in a chat. And I know Maiyia is keen to engage with you all through this morning. Thank you, Maiyia.
Well, thank you, Rebecca, for that warm introduction. Hello, everyone. As Rebecca mentioned, my name is Maiyia Kasouaher, and today I will be sharing the Community-Centered Dissemination Toolkit with you all, just kind of describing it, but also hoping that I'm able to show you how we used it in one of our projects as well. So the agenda for today really is looking at why you should engage communities in dissemination, and then talking about what the Community-Centered Dissemination Toolkit is, and then providing you with an example for one of our more recent projects that we just completed. And just to add more to what the toolkit is that the Community-Centered Dissemination Toolkit is a collaboration between the Program in Health Disparities Research, or PHDR, and the Clinical Science Translation Institute, so the CTSI. Our objectives for today really is to describe effective dissemination strategies and why community-centered participatory approaches strengthen dissemination planning and implementation, and then to introduce the skills and tools to help you develop a community-centered dissemination plan. So why should you engage communities in dissemination? There is an increasing focus on moving research knowledge to action, right? So looking at that translational science piece, that's translational research component. Regardless of where you fall within the research spectrum, right, from bench science to community-based participatory research, engaging communities is crucial to successful translational research. Communities also inform and benefit from the research findings, and there are unique skills that are needed to share knowledge in a manner that is engaging, meaningful, and impactful to communities. And the assumption behind this, this bullet is that community members are the ones with that unique skill and knowledge, right? That they are the ones who know the ins and outs of their communities, that they have information that outsiders who are not part of the community might not have or understand the best ways to communicate with folks from that community. And dissemination approach and budget need to be considered in proposals. So one important component of the Community-Centered Dissemination Toolkit is to have research teams think about dissemination early on. So to go through this, this toolkit with your research team as you're writing a proposal to give you an idea of what the dissemination process and plan would look like. And then as you go out and do the project and complete the project, it gives you an opportunity to revise and update your dissemination plan. So what is the CCD Toolkit? So the CCD Toolkit is the Community-Centered Dissemination Toolkit, and it's a resource to incorporate community engagement principles into dissemination and dissemination planning. And it consists of 5 steps to help research teams plan their dissemination. And I'll go over those 5 steps in a little bit. The toolkits can help you proactively engage communities to communicate research findings in ways that are meaningful and relevant to those communities, include communities that are impacted by and best positioned to make change. And this is also an important concept too, is to be intentional about disseminating your research findings to those who can make change and make an impact. And then to create a dissemination plan as early as possible with plans to revise throughout the life of the project. And I mentioned this a little bit earlier. And then to practice equitable partnerships. So really looking at practicing equitable partnerships between the community partners and the academic researchers. The intended audience for this toolkit are researchers, both university, academic, and community researchers, research teams and partnerships, and community members and organizations who may want to share their internal findings and look for a way to disseminate some of the information. So I provided here the websites or the Z links to the toolkit. So the first one is really just the website. The second one is to download the PDF. And the PDF that we have for the toolkit is a fillable PDF. So you can download it and type your responses directly into the document. So there are 5 steps in the Community-Centered Dissemination Toolkit. The first one really is to gather a team. In applying some of these steps, we find that depending on the makeup of your team and how long you've worked together, and who else is already on the research team, that sometimes steps 1 and 2 can be swapped. And so sometimes it might help teams to define a goal and then figure out who else needs to be invited to the table to make sure you can accomplish that goal, the dissemination goal. And then other times, you would open the floor and kind of discuss about who else you need to invite, and then refine that goal, and then figure out whether or not you need to invite more people, or if you already have the right people at the table. So in the first one, really gathering a team would include members of the research team and communities that encompass your audience. So really looking at the target audience and including folks from that target audience to be a part of the team, the dissemination team. And then those who also benefit the most from learning about the results. So including them into this conversation, this planning process. And it's also important that teams compensate their community researchers, experts, and consultants. So to make sure that your budget can allow for inclusion of additional team members. The second step is to define a goal. So really looking at what you hope to achieve by sharing your results out to others, right? So what is that dissemination goal that you have? And remember to keep your goals measurable and achievable. And then this last little point here really is just to make sure that you get to go back to step 1 after you've defined your goal, to make sure that you have all the right people at the table in order to accomplish that goal. And large research projects, there may be more than one dissemination goal. And so it is normal to have more than one dissemination goal. And for each of the dissemination goals, we are asking you to kind of think about an action plan for each of those goals. And sometimes an action plan will be able to meet more than one dissemination goal, which is fine as well. But really to have teams think about that. So that brings us to our third step, which is develop an action plan. To further develop your dissemination plan, right? By defining your audience, looking at the types of dissemination products that best convey your key messages, and then thinking about how you plan to share the dissemination products. And then the fourth step is to identify the resources. So really to incorporate community and culture assets as resources as well, as determining what additional resources you need and how you will get them. And the last step, step 5, is to evaluate the impact. So once you put something out there, you want to know if that made a difference, if you're able to make any changes, right? And that kind of ties back to step 2 when you're defining your goal. So it's important that you have really clear, measurable and achievable goals, because then when you're evaluating your dissemination product in step 5, then it's easier for you to evaluate that piece. So really to determine the impact of your dissemination product. And I'll go a little bit more into detail for each of these steps and the questions that we ask folks to think about. So in this first one, we are asking people and research teams, who is the audience of your research? What expertise and networks do you need, right? So who else is missing at the table? Who needs to be there? And how do you plan to engage these new community partners in dissemination planning? So how are you thinking about making that space, the dissemination planning space, more equitable and working with different folks? And we have worksheets for each of the steps so that research teams can type in the responses to these questions. The second step, looking at this, defining a dissemination goal, we have 4 categories listed here. And these categories came from the Robert Wood Johnson Academy Health publication to help us kind of think about different ways of dissemination products, right? So the first one could be then to, if folks want to raise awareness and educate patients, communities, or the general public, or if their goal is to promote change in systems or organizations, or to advocate for and support community action, or to influence local, state, and national policy. So to have dissemination teams kind of think about, where does your dissemination goal fall within these categories to help the teams kind of become more focused on what the dissemination products might look like, what who the target audiences are, right? And what that the space that you're planning to share the dissemination would look like. So the third step is to develop an action plan for each goal. So once you have your goal defined, really looking at who the target audience is, right? And who needs to learn about your research, what key research findings and messages are most important for the target audience that you identified. So in a large research project, you might have multiple findings, right? But not all of those findings would be relevant to the specific target audiences. And so for the research team to be able to match the key findings that speak most to the target audience, and make sure that that message is crafted well, right? And that's also where you would need, the community partners then to help you craft those messages in a way that speak to the communities of the target audience. And how can target audiences best learn about key findings, right? So what format, what platform, what kind of dissemination products will you create and how will you share it? So really thinking about what is it that would be within the budget, within the timeline, within the scope, right? In terms of the dissemination product, and how are you planning to share it? And for this third step, we have a dissemination action plan worksheet that kind of helps teams dive more into how do we choose what dissemination product we want to create, right? And so this action plan worksheet really kind of guides teams to do that, having them think about the type of dissemination products that you plan to create. So kind of brainstorming a list of products that would be helpful in making sure that you achieve your dissemination goal and that speak to the target audience. And then having the teams think about who will share and deliver and promote your products. And then how will your products be shared, right? In what space, when and where. So really thinking about the timing of dissemination, right? So, if we're disseminating to results to a school, it would be important for us to think about the timing of when school is in session, right? Or when there's certain board meetings and things like that. So being really thinking ahead to make sure that you're intentional about the different spaces that you're planning to share your dissemination product. And the fourth step is to identify resources. So what does the team need to be successful? And having the team think about how you can incorporate community and culture assets into dissemination planning. We do have a resource directory. Let me see if I can share this. Yes. So in our resource directory here, really providing local resources for folks who are planning to do dissemination to be able to tap into. And this is a working document. If you have community partners or folks that you work with to disseminate your findings that you would want to me to add onto this list, please send me an email with that information. I will contact them, get their permission to be on the list, and then add them to this list. And this list can be used can be used in different spaces for research teams. So we have folks in theater, folks in graphic designing, community spaces, right? Radio. And then there are some resource directories that were put together by different organizations that we've also received their permission to add onto this list. Some resources to help folks think about plain language when you're thinking about crafting that message. And then the second tab here, kind of putting together a list of how-tos, right? So there are some resources out there already on how to write a policy brief, on how to publish research in a journal. So giving research teams tips and ideas on how to do some of these things. Okay. And then the last step is to evaluate your impact. So really having the team think about, did you meet your dissemination goals? And what kind of impact did you make? And we have an evaluation plan worksheet to help research teams think about that portion as well. I understand that evaluation is a project in and of itself. And what we tried to do in this toolkit is to kind of streamline the evaluation process so that it's manageable by the research teams to evaluate their dissemination product. And I do want to just open the floor up for questions if you have any questions about the toolkit before I go on to the next section where I am applying the toolkit in one of the examples of one of our projects. And I can't see any of the questions or chats somehow. So I don't know if there are any, Rebecca, or if I should just continue.
I think you can just continue, Maiyia.
Okay, okay. So the example that I wanted to share with you all is one of the projects that we just finished disseminating information out to, and we are working on the evaluation portion of it, of disseminating our evaluating our dissemination product. To give you a little bit of a background about this project, we partnered with Cook, the university, a community university healthcare center, with Solamo, and with Welshare International. And our objective was to create short, culturally and linguistically specific COVID-19 messages for Hmong, Latino, and Somali older adult patients and their families at Cook, and to understand patient preferences for messaging technology. So what are the best ways that, clinics can share health information to patients, right? So what are patient preferences for that? And what we did is we created 6 messages, interviewed patients, and we analyzed the interview data. And so once we have our messages, the main messages that we want to share with folks, we gathered, so we worked on gathering a team, right? The dissemination, the research team was much larger, and some of the folks from the research team then who wanted to be a part of this dissemination group, we created that subgroup, right? So we had our dissemination subgroup team, and we had them complete the toolkit steps individually. And then we met to discuss the steps. So in terms of the process of using this toolkit, that's what we did for this particular project, was to have folks look at it, to think about it, and then to write their own responses, and to come together and talk about it. And folks identified other community members in this first step when we're thinking about gathering a team that we could include. And then we went on to talk about defining a goal, right? So what is the goal that we have that we want to focus our dissemination product around? And after defining a goal, we realized that the team we have will be able to help us achieve the goal. But then also looking at, the timing and the budget as well, right? Can we afford to make additional new connections? And in terms of the timing of the project, and then also the financial piece, right? Can we compensate additional folks to be a part of the team? And the goal that we came up with and we agreed on was to inform clinics on patient preferences about messaging mediums and methods to influence clinic methods and approaches to creating and delivering health messages to patients who identify as Hmong, Latino, and Somali. So really the goal is to share what the patient preferences are, right? And how patients prefer to be engaged in creating those messages, right? So that we can hopefully influence the way that clinics engage patients in creating and delivering health messages. So that was our goal. And after we defined our goal, we went back to really look at the research team and realize that we have all the folks that we would need in order to accomplish this goal within this time period. So our team then consisted of community researchers from Salamo, clinicians and staff from Cook, and academic and student researchers from PHDR. And then we went as a team, we continued to use this goal and developed an action plan around it, really looking at who that target audience is. And our team identified clinics as the target audience, right? So clinic staff, clinic communication teams, decision makers within the clinic that help create and deliver health messages to patients, patient advocates, folks that would be within that communication stream to help share some of the health information to patients, right? So really looking at community health workers and staff and folks involved in the clinic in that space. And it really helped that our research dissemination, our dissemination team included clinicians and staff at Cook, so that they can help us identify spaces within the clinic that someone who is not a part of the clinic, right, who doesn't work there, might not know that there's certain spaces that staff already gathered to learn about information, right? So it was important for our team that we had folks who were part of that and who had that knowledge help us think about just different dissemination products. The key messages that we wanted to share to the folks in the clinics are that patients value culturally tailored messages, really talking about the patient response to the messages that we shared, and that messages should reinforce prior knowledge and encourage new behaviors, and providing examples and quotes from the patients at Cook about what they thought of and what they thought of the messages and how the messages help them to learn about how they can behave, to take more precaution to prevent the spread of COVID-19. And the last key message really is that patients prefer phone calls and video over text. And this really also speaks to the access that patients have to phones, right? And the assistance that elders, right? So older adults in these communities have in terms of their access and their ability to use phones with the help of family members. So after our team talked over, who the target audiences are, refining our key messages, we decided that we were going to present at the Cook has learning module sessions, and they have monthly learning module sessions, and our team got on the schedule, and we had our community researchers present at this session as one of our dissemination products. We created an infographic to be more widely shared. And then we are working on developing, refining a manuscript. And the manuscript is co-authored by the community partners as well. So it's not just the academicians that are listed as co-authors on the manuscript, but really working closely with our community researchers and partners. The fourth, when we're thinking about identifying resources, right, time constraint prevented us to hire an external graphic designer. Ideally, we were thinking about hiring someone external to come help out with creating the infographic, making sure that the messages are consistent and the branding looks pretty. But instead of being able to hire somebody external, because of time constraints and the timing of how we want to get things out, we decided to use a team member who has skills in graphic designing to help complete some of these things. So really leveraging the expertise of the folks on the team already. And financial resources that we have, we were able to compensate the community researchers for the contribution. And we had connections to the clinics, right, where we can share and disseminate our infographic and our information. For the last step here, evaluating the impacts, we started disseminating the materials last month. And so we are in the process of gathering feedback from different places and trying to look at the impact of the dissemination product that we put out there. Cook has, after the Cook presentation, they do have an evaluation that they send out to all the attendees. And we will be in contact and working with them on how to understand what some of the evaluation components from that presentation are, and how we can look at how that may help inform the impact that our project has made on the clinic, and how the clinic engages their community partners and creating health messages for their patients. So that is all that I have in terms of the speaking portion of sharing what the toolkit is. In an ideal setting, we would be able to work with you and provide you more of a hands-on experience to work on the toolkit and to use the toolkit in the session, so that you get a chance to apply it to one of your research as well. But if you would like to introduce the toolkit to your team, or would like individual training sessions, some one-on-one help with some of your projects that you're planning to connect with communities for, we can help out with that piece as well.
Thank you so much, Maiyia. We have a great question from Dana Carroll, who asks, how did you approach making an infographic that was culturally tailored but also relevant across these 3 different cultural groups? So I was wondering if you could speak to that a little bit.
So the infographic that we have, because of our target audience, was with clinics, right? So this is the part where it's important for the team to think about who that target audience is, right? So because our target audience is clinics, that we were able to, we did a cross-cultural analysis and worked with our researchers, we're able to come up with our messages through that kind of consensus process, so that the messages that we wanted to share with the clinics were relevant for all of the 3 cultural groups. And so in the infographic, because our target audience were clinics, we left it at English, right? So we didn't translate it. If we were to expand that one to community partners outside of the clinic, then we would translate those into the different languages.
Dana's reading my mind this morning a little bit, because the next question is, can you at first, appreciating your answer, it's very interesting, but also can you explain more about the cross-cultural analysis? And I think what a lot of people might be wondering is about that process of looking, often projects are so oriented to providing messages for individual groups. And what's very unique about this work is the combined messages across 3 cultural groups. Could you talk a little bit more about that process, the cross-cultural analysis? And I'm thinking it would be interesting to hear about, what are the strengths that brings, and also what are some of the challenges with that?
I will stop sharing for now, so that we can. There we go. And so for that cross-cultural analysis process, we had folks who, community researchers from those communities, so who identified as each of the 3 cultural groups, to not only do the interviews, right, but then also to do the analysis. So we partnered with, having somebody from Sulamo, partnered with somebody from the university. So kind of coming up with teams to do the cross-cultural analysis portion of it. So each of the individual teams then did their own analysis. They did their coding based on what the patients from that community said about the messages. And then we looked at all the codes. We came together, looked at all the codes. We kind of talked through the codes to make sure that, these are concepts and ideas that based on your interviews, right, with the patients, that this is something that you feel patients will also say, and also from the community researchers, their knowledge of their community as well, and really heavily relying on their knowledge and their expertise in their communities, to say, yes, although folks in the Hmong community didn't specifically talk about connecting with the folks that appeared in the video, right? That concept came up in the Latino community, that's something that I think the folks in our community would also agree with, right? That we appreciate that component of it as well. So there was a lot of conversation across multiple cultures to make sure that the final codes that we have and the key messages that emerge from that span across all the different cultural groups. I don't know if that answers the question completely, but that's a process that we took to understanding what community members and patients are saying, what community researchers are understanding, and their interpretation of what patients are saying, and making sure that everyone in the team kind of is on the same page with that as well.
Another question from Dr. Yi. Is it possible to contact patients with specific diagnoses? For example, could you contact people who have tested positive for COVID to ask specific questions? For this particular study, we did not do that. And I think that would be something that will, if that's something that you want to do, you might have to just go through the clinic, make sure that you comply with all the HIPAA regulations. And for IRB as well, right? Because for this particular study, it was looking at kind of the patient preferences as well, right, to messages and patients responding to the messages. So it didn't have anything to do with the patient's health conditions. It's more of how they identified in terms of their ethnic cultural groups, right, and the linguistic groups. And making sure that we're able to just communicate to patients in a way that they understand. Okay, so for this project, it was more broad, but say in the example of perhaps a topic such as like breast cancer, it would just be a different process that would be focusing more on a subgroup. Is that right? Yeah. Could you share a little bit, Maiyia, about the benefit for clinics and having information that's tailored in this way, as opposed to information that's tailored by cultural group, the benefits in perhaps that provider environment of having a multicultural resource, as it were?
Yeah, so I think that the benefit for the clinics is that they get to hear from the patients in a different way, right? Because many of the clinics already engage patients in different spaces as, patient boards, or having patients, hiring patients on as interpreters, right? And clinic staff. So there are different ways that clinics are already engaging patients, but I think there's also a subset of patients that are more likely to share their input and responses in those spaces, right? So sometimes clinics ask for feedback on the work that they're doing, and only some patients are more inclined to actually give them that response. Whereas this opportunity then means that we're reaching out to patients who may not necessarily be able to provide the input to the clinics, right? So we have researchers who speak to the patients in their native language and to understand kind of what it is that they're trying to say and how to share that information back with the clinic. So I think that's a huge benefit to clinics, is to have that kind of resource to be able to reach patients that you probably haven't heard from before.
Thank you. I do have a follow-up question from Dr. Yi, and that is, for many of our investigators, they want to only survey people with a specific cancer diagnosis, but in those same groups that you've outlined today. Could you give some examples or thoughts about how people might go about doing that?
So I think that question sounds, for me, my interpretation of it sounds more of like a recruitment question, right, than a dissemination question. And so I think that, one of the, and I can give you my suggestion in terms of, a community researcher who, if I were to be brought onto a project to do this and to connect with Hmong folks who have who've been diagnosed with breast cancer, right? And how to recruit some of those folks, right? I can give you that. And we can connect at a different time on that too. But I think just speaking to the dissemination component of it, one important piece of this dissemination toolkit is to have research teams think about the patients and the participants and pulling them into planning dissemination. So let's say once you have already connected with some of the patient the patients who have that, who have been diagnosed with breast cancer, that when you are sharing information back to that group, right, that it's important for research teams then to kind of think beyond just the research team that we already have here, but to include potential participants. Maybe there's a couple of participants who are really vocal and really comfortable with being on the dissemination team. You can invite them to be on the team to help you think about more creatively, how can we reach folks from your community who have breast cancer, right? And that patient then will be able to give you the type of insight that the team might not have.
Okay, and I think, Doctor, you gave the example of thinking about what kind of survivorship follow-up did people have after a cancer diagnosis. Is there anything you'd add to that example?
No, the survivorship follow-up, I think that there's a lot, like just culturally, just thinking about in the Hmong culture, right? There's a lot culturally in terms of cultural assets that that would play a huge role in the conversation on survivorship follow-up. I have family members who have passed away from cancer, so I won't be able to give you that kind of insight. But I know that there are others who have survived cancer, and so the families, the support groups within the communities will be able to provide you with that kind of structure that they have in supporting each other. To kind of address some of the questions you might have around survivorship.
I'm going to pop in the chat here too, Maiyia, the link to the Toolkit resource for people if they're interested to find out a little bit more there as well. Any other last questions? It's been a wonderful discussion. Looks like we're all quiet there. So anything else that you'd like to add, Maiyia? Just a couple more concepts and ideas that I've been hearing is this something that folks in bench science can do, right? And so I've had some folks ask questions about that. What if your project wasn't originally community engaged, right? And I think this toolkit is designed in a way where folks can use it even if the original project wasn't community engaged, but they want to engage communities in the dissemination piece, right? And I think it's really important for us as researchers to think about the work that we do, and really the goal of the work that we do what we do because we want to improve the health of people. And so how do we do that? And how do we share the information back to the people that are most impacted by the things that we're learning about, right? So there's, there are a lot of things that research teams can think about and different ways of how you can engage communities at different levels of engagement as well. But really to think about, expanding the dissemination planning process to include folks, participants, and maybe folks from the target audiences that you need to get this information out to be a part of that team, so you can do that more effectively and more meaningfully for the folks who need to hear it. Wonderful. I think that that's an excellent spot for us to wrap up today's seminar, unless there's any last questions. So thank you so much for your time, Maiyia. I think that this has been a wonderful presentation. I think there's some excellent resources and it's been a great discussion here. And I think that we should all take to heart your message about thinking early and deeply about how to engage the community in dissemination, no matter what type of research we're doing and from early on in the process. So with that, I'll call our seminar to a close today. Thank you, everybody, and we look forward to seeing you again in next seminar.